The Caldwell Luc Operation is a specialized surgical approach to access the maxillary sinus through an opening in the canine fossa. It's primarily indicated for chronic maxillary sinusitis that hasn't responded to conventional treatments like antibiotics or endoscopic drainage. Removal of foreign bodies or dental materials that may have entered the sinus through dental procedures, persistent oroantral fistulas following dental extractions or trauma, biopsy and management of tumors or cysts in the sinus, and drainage of mucoceles or other obstructive pathologies within the sinus. This approach provides excellent visualization and is often preferred when endoscopic methods are insufficient. An essential part of the Caldwell Luc procedure is identifying the ideal entry point into the maxillary sinus. According to Robinson and Formels, this point lies along the mid-pupillary line and transects at the level of the nasal floor, approximately 1 centimeter above the gingivobuccal sulcus. This location minimizes the risk of damage to critical structures, providing a safe and effective route into the sinus. After administering local or general anesthesia, a small incision is made along the gingivobuccal sulcus in the maxillary vestibule, ensuring it aligns with the mid-pupillary line entry point. Using a periosteal elevator, the mucoperiosteum is reflected to expose the anterior wall of the maxilla. A small opening is created through the bone to access the sinus, with care taken to avoid damaging surrounding structures. Once inside, the sinus cavity is carefully inspected, and any infected tissue, polyps, or foreign material is removed. The sinus may be irrigated to ensure all debris is cleared. After confirming that the sinus is fully treated, the incision is closed with sutures, allowing for proper healing. Postoperative care includes managing swelling and pain, typically with cold compresses and analgesics. Patients should avoid any activities that increase sinus pressure, such as blowing their nose. Potential complications include numbness in the upper teeth or cheek area, infection, or, in rare cases, fistula formation. The Caldwell Luc operation remains an important surgical option in cases where direct maxillary sinus access is crucial. Understanding the anatomical landmarks and procedural details is essential for safe and effective outcomes.